The honourable member for Esquimalt, Wanda Fuca.
Speaker, what we're dealing with here is not a political issue, but we're dealing with a medical issue, and we're dealing with a humanitarian issue. Mr. Speaker, the challenge is precisely this. Right now, every minute of every single day, a woman dies as a consequence or during pregnancy. That's 530,000 women every single year. They essentially die from 5 largely preventable causes. Women bleed, hemorrhage, babies get stuck, obstructed labor, they get infection, sepsis, they get something called eclampsia where their blood pressure goes high, they get seizures and they die. And also, 63,000 women a year die as a result of septic abortions. Those are abortions that they go to get because they have no other option. What does this mean? It means when the mother dies, more than half of her children also die who are under the age of 5, Mr. Speaker. And I think many of the members of this House do not understand that. So the death of the mother presages a death of most of her children under the age of 5, which is leaving not only a sea of orphans, but also a sea of children who die that are completely unnecessary. So how do we deal with this? It is true, and the government is correct to say, that health systems are the key. And it's focusing on the basics. Having a trained healthcare worker, access to the proper medications and diagnostics, clean water and proper nutrition, and access to a full array of family planning options, including, Mr. Speaker, family planning options including access to abortion in those countries where it is legal. And I'll just quote, Mr. Speaker, the World Health Organization really talks about this in a very important way. And they say that family planning, and they define it as such, allows individuals to have the desired number and spacing of children via the use of contraceptive measures and treat involuntary fertility. In other words, family planning is voluntary and contraception is tailored to the individual needs. We can't go and try to foist our morals on other people, and no one is suggesting that for a moment. But we have to be able to support, Mr. Speaker, that which is known to work and that which is legal in the countries that we're trying to assist, congruent with what they want. And why are we so focused on family planning? Because, Mr. Speaker, if you can provide people with family planning, you will be able to save more than 1/3 of the 530,000 women who die every single year while they are pregnant. Imagine that. 1/3 of those women's lives will also be saved, including, Mr. Speaker, 50% of the children that die during early childhood, their lives will also be saved. So if the government wants to truly save lives, then they absolutely have to follow the science, and they have to follow enabling people to access a full array of family planning options. I might say, while the government has spoken about not opening the door on the abortion issue, we say, amen. Because if you don't want to open the door of the abortion issue, then the logical conclusion of this is that you have to give people the rights that are currently in existence. And those rights, Mr. Speaker, include in our country a woman's right to be able to have access to a safe abortion. Why, Mr. Speaker, is the government choosing to pursue preventing women in other countries from having the same rights as women in our country do? In fact, if women in Canada and men in Canada didn't have access to a full array of family planning options, we would have a much higher rate of maternal mortality and infant mortality in our country. What is also interesting when it comes to family planning is that the reason why this is important from a medical perspective is that if we give women the ability to control their own fertility, in other words, allowing women to space their children out, not have them too young or too old, then what happens, you're able to enable a woman to be able to have her children at the correct number, at the correct spacing. Indeed, the United Nations recognizes the right of women to do this. This is a long-established right, Mr. Speaker, for women to be able to have this particular right. On the abortion issue, in 1994 in Cairo, the United Nations members, including our own, came together and agreed that women should have the right to have access to safe abortions in those countries where it is legal. The interesting thing, Mr. Speaker, is if we're able to get this picture right, If we're able to invest in the health services that I mentioned, the trained healthcare workers, meds, water, micronutrients, I might add, because more than 80,000 women die as a consequence of iron deficiency anemia every single year. And Dr. Zlotkin from U of T and many others in Canada have been champions of the micronutrient initiative that we call pennies from heaven. And we call it pennies from heaven because a small investment will go a long way to being able to save not only mothers' lives, but also children's lives too. As I said before, what is interesting is if we get the health systems right, if we can treat the pregnant woman, which is Millennium Development Goal 5, what is very interesting is that you can also treat 80% of what comes through your emergency department. The big killers, gastroenteritis, pneumonia, tuberculosis, malaria, malnutrition, HIV/AIDS. If you treat and focus on the pregnant woman, Millennium Development Goal 5, you can also treat 80% of what comes through your emergency department. Said another way, there is no single greater input of finances. And the government speaks about this in terms of wanting to be effective, in terms of using the taxpayers' money, which we are all behind. If you want to be most effective and being able to make the most effective, sensible, cost-effective use of the taxpayers' money, you have to, the answer that pops up is family planning. Access to family planning is the most profound, cost-effective way to be able to improve the health of populations, as well as to be able to improve in fact, the economy and environments of countries. The reason why the Liberal Party put this motion forward, Mr. Speaker, is the government has started to change their tail a little bit. And what they're saying is that they're going to not close the door on any family planning options, but we're not going to open the book on abortion. What does that mean? It can mean a lot of things. That's very different from saying we're going to embrace enabling people to access family planning. We're going to bring it to the G8 table and G20 table. We're going to work with the most powerful leaders in the world, and we're going to include this as part of an integrated plan that will save women's lives, men's lives, and children's lives. If, Mr. Speaker, the government does not do this, then not only does it mean the death that could be prevented of millions of women and millions of children, but it also will prevent many men from living too, because and women too, through the HIV/AIDS issue. Because what the government will, in effect, has been saying up until very recently is they're actually not going to promote simple, well-known options for people to prevent and protect themselves from the spread of HIV. What kind of government can possibly get it into their mind that they're going to deprive people from having the tools that they need to have to protect themselves from HIV and other sexually transmitted diseases? For the comfort of us in this particular room, this is not something that's well known. I'm a physician. I've worked in Africa, Mr. Speaker. I've worked in right next to a war zone. I've seen some pretty horrible things. And one of the shames of the world is the use of rape as a tool in conflict. In places like the Eastern Democratic Republic of the Congo, 70% of the women in some communities have been raped and gang raped. Mr. Speaker, what option does that woman have if she's being gang raped and she's pregnant? Does the government can they truly look at themselves in their own hearts, in their Christian hearts, if they are Christian, and ask themselves that they can look in that woman's eye and say, we're going to prevent you from having an abortion even though you want one. Even though if you take this fetus to term, you will be a pariah, you can't handle it, it's psychologically devastating to you, for whatever reasons that she may have. Do members of the government, if they look in their heart, can they truly think that they could look, if that woman was sitting here today, that they could look in her eyes and say, no, you will not have access to aseptic abortion? I would ask them, Mr. Speaker, to reflect on that, because that is the reality in too many countries in the world. That is why the world has got together behind what is known as an integrated series of options and initiatives that will enable us to save lives, what the government says they want to do, save children's lives, men's lives, women's lives. Mr. Speaker, I understand the sensitivities members on the other side have on the abortion issue. They may have their personal opposition to it. That's their right. but they don't have the right to deprive other people of that which will save their lives. And that's the crux of the matter, Mr. Speaker, and that's why we have brought this up today.